Discovering vascular dementia. The prevalence and demographic of vascular dementia, there's age to consider. 85 and older have more prevalence in having vascular dementia. Vascular dementia can also be acute and can happen at any age due to the symptoms of after effect of having a stroke. African American males, as a research study at the University of California, San Francisco, states that elder African American males have a higher percentage in the population for vascular dementia. And this is stated as because of their diet choice of greasy fried foods, also their genetics of having high hypertension and high cholesterol. As far as common and the most familiar type of dementia is Alzheimer's disease, comes in at number 1. And the second most common type of dementia is known as vascular dementia. The risk factors of vascular dementia. There's several. Some of, just to name a few, atherosclerosis is a risk factor, any heart disease, high cholesterol, hypertension, stroke, smoking puts you at risk, and alcohol use puts you at risk. The pathophysiology of vascular dementia, progressive worsening of memory and cognitive function, ischemic brain injury, genetic history of heart disease, high cholesterol, and high blood pressure. There are many signs and symptoms for vascular dementia. Noticing a difference in balance and coordination in patients that have vascular dementia. The inability to stand and walk straight. With coordination, they seem to lose their, along with the balance, the inability to grab objects, dropping things, and they also have frequent falls. With vascular dementia patients, memory loss is a concern. They have difficulty remembering things, and this worsens over time. Their loss of focus to attention is another sign. They're easy to lose focus and unable to pay attention. Being restless and in motion all of the time, not able to relax, sit still, feel agitated, pacing or walking around the room. Decision making is also difficult for these patients that have signs and symptoms of vascular dementia. They're unable to make decisions or choices on their own. Assessment tools. The mini mental exam is one of the most common assessment tools used in healthcare. As a nurse, I often use this with patients that do have a history of dementia, Alzheimer's, or have had a prior stroke, have some memory loss, cognitive effects. I use this to assess the patient, their cognitive function, their orientation level, and their memory. There's also an AMTS exam, which assesses the patient's concentration and memory. Here in the graph, this shows the brain, the particular area, the temporal lobe, which is where with dementia, the memory, understanding, and language is a concern. Also the parietal lobe, the perception, making sense of the world, and spelling. Sometimes when patients have stroke, they have deficits in these areas, along with movement. And this is also some signs and symptoms that you'll see with vascular dementia patients. As far as my personal assessment that I would consider with a vascular dementia patient is assessing the labs. I want to take a look at the cholesterol level to see if that is a concern, as well as the vital signs in the blood pressure, if they've had high blood pressure. Assessing the blood glucose level. Some of the patients that have vascular dementia also have diabetes, and sometimes their blood sugars are not well maintained. Coordination and balance is something I would look at. Their speech and their medical history, any medical history of them having a recent stroke or in the past. And these are my references.